I'm an anesthesiologist in Edmonton. I practiced adult cardiothoracic and pediatric anesthesia for almost 20 years. And then I transitioned to pediatric palliative care back in 2017. I am passionate about my practice, my patient population, my colleagues, the profession, and medical ethics. I got involved with medical ethics because it became obvious that there was a lot of gray areas in medicine where it wasn't always clear what the right thing to do or the most reasonable thing to do for patients would be. Well, medical dilemmas are anything where the right answer isn't always obvious. You know what your obligations are to patients, and in certain situations it's not clear which pathway would be the right one for a patient or for a particular issue that's involving a patient. And so then you have to kind of revert back to the principles that guide our profession and guide medical ethics to help find a good framework for problem solving around those sorts of dilemmas when they come up. My passion really started, I would say, early in my career. There was a series of cases that caused me to really think about whether I was advocating appropriately or sufficiently for my patients and their families. I just felt like I didn't have a tool set for that. Like it felt like I needed to go and learn more skills in order to help promote and advocate for my actual patients. So this was really bedside advocacy, like how do I do that? Obviously I used it for medical education to help support the medical students and the medical residents and fellows as they're going through the process of learning their specialty. So a lot of it is me getting asked to help, and my whole approach to bioethics, my whole career since I kind of got into it, was if someone's asking for help, I say yes. Again, just that openness to the questions and creating a safe space for people to come to you and talk to you about things that are often really troubling to them, and it can cause a significant amount of moral distress. So you need to be able to create that space where people feel like they can come to you and talk to you about these things and trust you. I think the most passionate part of my practice right now, like from an ethics perspective, is the moral distress that I'm seeing in my colleagues and my allied health, my teams. And a lot of that just really ramped up during the pandemic. And so just the need for people to have a place where they can talk about the moral distress that they're going through. I can't necessarily solve their moral distress. Sometimes I can provide them with sound frameworks to help them understand why decisions are being made, but there will always be some residual moral distress that they're dealing with from feeling like they didn't do necessarily what they hoped for a patient or family or for their teams, and how to work through that.